Welcome to the Pet Loss Companion. I'm Ken Dolan-Del Vecchio. I'm here with my friend and co-author Nancy Saxton-Lopez and a special guest who we'll introduce in just a couple of moments. This is a program that we do every Thursday from 6 p.m. to give or take about 6:30, and it is an opportunity to connect with people in a broader and more interactive way than we're able to through our book, on which the program is based. And that book is called The Pet Loss Companion: Healing Advice from Family Therapists Who Lead Pet Loss Groups. With this program, what we often do is we read emails that audience members have sent us telling us their stories, and then we give some comments on those stories. And people have found this to be very, very helpful and give a lot of solace and help them not feel so alone in their grief. So if you would like to share a story with us, please do that. You can send it to either me or Nancy or both of us. You can reach me at kenddv@gmail.com. You can reach Nancy at nsaxtonlopez at csmpc.com. That's NSAXTON LOPEZ at csmpc.com. You can also recommend a topic to us and or a guest. We are open to all suggestions, and we are very happy to hear from you, whatever kind of contribution you think you would like to make to the program. We're open to. Everything that I'm saying here is in the description below the program, so I'm just covering some stuff that might be helpful for you. You can support our work on this program in a number of ways through Venmo, PayPal, monthly subscription. This program is a friend of Dakin Humane Society in Springfield. Dakin does all sorts of things that are helpful to people and our animal companions. They offer a shelter. They offer different kinds of training. One of the things that they offer is a cost-free Zoom pet loss support group that I facilitate. And it's usually on the second Tuesday of the month. It runs from 6 p.m. to 7:30 p.m. and it is totally cost-free. And you can Zoom in from anywhere in the world. And in fact, we have had people Zooming in from all over the English speaking world, and places like Saudi Arabia, where I didn't even know that a lot of people speak English. The next program is the next group is on the 10th of October. I'll let you know that we're actually capping the registrations because we've gotten so many, that the groups have gotten so large, that we think it's useful to have about 25 people in the meeting and not more than that, because after that it just gets to be a bit difficult for those who want to contribute to talk. So perhaps if you're interested, you should RSVP as soon as you know that you're going to be able to make the meeting. Please consider also subscribing on YouTube if you find this program helpful, because when you do that, it raises the visibility of the program through the various algorithms that let people know that this program exists. And we have one other announcement that we would like to make, and that is that we have recently created an affiliation with a program called Bereave. They offer these really beautiful granite, beautifully engraved plaques that you can either use for a marker outside or inside. And if you purchase one of their plaques, you're also offering some support to our program. So today we have a very special guest with us. He's actually a returning guest who we're thrilled to have with us. And this is Dr. Andraya Cole. And let me tell you a little bit about her. Dr. Cole joined the practice at South Deerfield Veterinary Clinic in September of 2021. She grew up in central Massachusetts. She attended Hamilton College in upstate New York for undergraduate studies and Washington State University for Veterinary School. She also holds a master's in public health from the University of Minnesota. Dr. Cole enjoys the variety of mixed animal practice, but particularly loves working with cats and small ruminants, camelids, I should say, as well as client education. In her spare time, which I imagine is not very much, Dr. Cole enjoys farming with her husband and daughter, doing jigsaw puzzles, and discovering new places for great food. You can learn more about her at sdvcl.com. veterinarianconline.com. Her information will be in the description as well, but just to make you aware of that. So welcome, Dr. Cole.
Thank you. Thanks for having me back.
Yeah, we're very happy to have you. And we want to talk today about the human element of veterinary practice.
Yeah.
And so, Nancy, do you want to get us started with questions?
Yeah, I mean, I think Dr. Cole would be really interesting and helpful. How did you decide on veterinary medicine, and what kind of feelings? I mean, we're going to be talking a lot about compassion. What kind was compassion part of that decision? And that would be really nice to hear how you got to where you are now.
Yeah, I think it's kind of twofold for most people. There's usually that element of when you're a child, you have this just bond and attraction to animals. You care about them, you love them. There's this feeling, at least for me, this overwhelming feeling that I liked spending time with animals more than people. And so there's that. That's the kind of initial stage, I think, for most people, right? But then there's more of a shift into realizing that veterinary medicine it's medicine, right? It's a science. There's a lot of education behind it. There's a lot of schooling and things that go into it. The whole education process and curriculum is pretty rigorous. And so for me, I always knew I wanted to work with animals because I loved them. I was filled with compassion for them, but I didn't really decide on actually becoming a veterinarian until probably midway through college. I thought for sure I was going to do wildlife or biology in some capacity. I studied abroad during college in East Africa, and I worked with some of the animals there, but I found out quickly, like, research and things were not for me. I wanted to really be hands-on. I wanted to feel that feeling when I get to touch an animal and work on an animal and also apply the science to it. And so that for me was a bit of a shift, maybe later than some people who just kind of always know. I think that's a common story. They just always knew they wanted to do it. But once I kind of set my goal on that, I went through the schooling and that's where I found certain passion. Like it was right for me. But yeah, I think compassion, like you mentioned, is like the predominant emotion for everybody I've talked to that has gone into this field and has found that it is for them. Compassion towards animals. Yeah.
For the animals, right?
For the animals.
What happens though is you as veterinarians have two clients, right? So they have animals, but they also have the pet parents. And that can be a little more challenging.
Absolutely.
Depending on the person.
I think it's really interesting because we all go into this knowing that the human-animal bond is so strong, that it's real, first of all, right? That it's very real, that it's strong, that it persists, and that it's important for so many people, their mental health, their physical health, all sorts of aspects. So we all know that, but we're also the people who are not so inclined to talk with the people first, right? Or who aren't very good at it, or who didn't go into human medicine particularly because we didn't want to do so much with humans. But it's exactly what you're saying is we have two clients. Our priority first and foremost is to advocate for our patients, our animal patients, right? But we spend the majority of our time bridging the gap between that means for the pet parent and what that actually can translate into for the medicine we can do on their animals.
So let me ask you a question. I mentioned before this little story about a veterinarian who was muttering under her breath, some people just shouldn't have animals when they were taking care of a person's dog. And is there training for veterinary students about how important it is to be compassionate to both the animal and their human?
Yes. I guess what I would love to say is that, yes, that is part of our standard training and curriculum, but that's not the case. There's absolutely nothing in place across the board countrywide. There are certainly programs in schools that are probably different from one another that incorporate some of those things. At Washington State, where I went, I was trained specifically in communication. It was a big focus and course that we took throughout our training, but I know that's not true for all schools. And part of that is always like, how do we communicate medical things first and foremost? How do we talk about these things? And secondary, how do we navigate some of the human emotions that come up with that, and how to kind of be able to have some of these complex conversations about chronic illness or end of life. And we don't get a lot of standardized training on that. It's really not, I think, a huge focus for the schools themselves. It's a lot of things I've learned through experience from working with a variety of people. Yeah.
Right, because obviously there's so much emotion, as you well know, when a pet parent finds out that their animal has a terminal illness or that may need to be euthanized. But that's kind of what came up with doing veterinary social work, right? So, and that's been a fairly new field for a period of time, probably in the early 2000s. I got my certificate at University of Tennessee, but it's also important for veterinarians to have some of those skills too, right?
Absolutely. Yeah, I mean, I think we really cannot do our job effectively without learning some of those communication skills. And also, I think a huge part of what I do is learn to read a room, right? So that emotional intelligence aspect, which I think is hard for some. I find it interesting. I've done a lot of work and training, and my public health degree really incorporates a lot of that. And so I feel particularly interested in being able to do those things, but I know it doesn't come easy for all people, especially kind of the type A that goes into medicine, right? It's maybe not as easy for everybody to navigate those things, but it really is first and foremost the most important thing, because if I'm talking to somebody who I can instantly read, like, this is too much information, you're going to shut down if I information overload you, versus somebody who I can tell, like, you need more and more and more information for this to process and for us to kind of build some trust and have a relationship where you feel like I'm being compassionate. It can be very different for different clients. And it's hard to know. You step into a room 15, 20, 30 times a day, and it's different every time.
Right. And it's different with practices too, right? Because if you're in an ER specialty vet, you have so many clients that you need to see or have to see, and you don't have the time necessarily to be able to sit with someone and really talk to them about what's going on. And it would be nice if that happens, but sometimes especially in ERs,
Yes. Yeah. And I think something that we had talked about kind of bringing into this conversation, excuse me, is the discussion about compassion fatigue, which I think is huge in my profession. And it basically, that's taking on emotions from everybody constantly taking on that trauma of somebody's worst day potentially of their life repeatedly, and trying to reflect that back at them and use that, but not take it home, not take it personally, not become basically really, really just exhausted by it to the point where you can't feel it anymore. Right. That's a problem. When I worked emergency, it was exactly that. I burnt out pretty fast, and I really did experience compassion fatigue. It's that constant reminder that, yes, maybe I don't have the time, or maybe this person doesn't have all the money, but I still have to find a way to show up, be present in this experience, because it is just the worst day of their life, or it is one of the hardest things they've had to hear a diagnosis, right? Even though I do that constantly, is unfortunately tell people difficult things, and it might not be too upsetting to me. It's putting myself in their shoes, which can be very exhausting.
Yeah, that's the empathy part of it.
How do you make that boundary? And both of us are therapists, and this is something we've worked with the breadth of our careers as well. But what would you advise a new veterinarian about how to set that boundary?
I think for me, what works, I'm a very analytical person, right? I went into medicine because I do love the puzzles. I love the science. For me, there are there are always going to be crappy situations where it's not cut and dry. But a lot of the time, through experience and time, I've learned that, no matter how much money somebody might have, we can't fix this. Or, even if, we have no money and we would love to fix this, the best option might be euthanasia because the animal would suffer otherwise. And so for me, I've drawn a lot of those boundaries by my medical training has given me enough knowledge to know when I should take on those emotions and when I'm really just making an appropriate medical decision that advocates for my patient.
Which is really helpful for the clients, right? For the human clients, right? Because they rely on a veterinarian saying, hey, well, this is what's happening. This is what is going to happen. And then talking about when the time is.
Yeah. And I think as a new grad, you don't quite have that much understanding or balance. You haven't maybe seen the number of cases play out where you can realize those things, but you also, you go into this field because you want to save animals. And when you get out, you realize that so much of it is not just medically, maybe you can't save them. It's owner compliance or owner finances or owner emotion that is going to play a role into how much you can and cannot do. That's right. And that's really hard. It really is hard, but it is setting those boundaries, I think, in your mind that say, okay, if this is the situation I'm dealing with, somebody's not processing this information or they are unable to communicate this information, right? Language barrier, cultural barrier, all of those things that play a role, then what can I do to make the best medical choice in this moment, right? And help them understand that.
But that also adds to the compassion fatigue, right? When you have an animal that would be saved, but the pet parent doesn't have enough money, or those kind of situations. I mean, those are really hard things to deal with.
Yeah. I mean, I can think of a few cases, but particularly in my first year out, probably within the first few months of working in the ER, I had a really young golden retriever come in who had a foreign body. It was a rock, very clear on x-rays, causing an obstruction. The owner couldn't afford surgery. And we talked about surrender, we talked about other options, and they didn't want to do it, and which is their decision. But ultimately, we ended up euthanizing this really otherwise healthy golden retriever pretty young. And that really, those are the situations I still remember. It haunts me, because I think, well, could I have done the surgery for free? Could I have done this? Could I have done that? But at the end of the day, it's those situations are going to stack up constantly. And you have to, unfortunately, say, if we don't have an option to surrender, if we don't have an option to do surgery, this animal will die a really painful, horrible death. And unfortunately, this is the gift we can provide, which is euthanasia.
Yeah, hard.
That's gonna be an interesting thing for people to hear. That story, I think, is really, really, really intense. Really intense. I remember, and very early on when I was seeing clients, I would repeat in my head, distance. It'd be like, this is them, this is me. Be present, be compassionate, but you can't take this in. You can't take it home.
Your gold shield.
Yeah. And you still do. I mean, obviously, these cases still affect you. That was years ago, and I still think about it, right? But it is something, those are boundaries you have to create, because I think the one thing, kind of getting back to your question about training and schooling, the one thing that I think we've been a bit behind on, maybe all medical fields, but particularly veterinary medicine, is dealing with the mental health of ourselves, right? So we haven't quite gotten to that step of talking about some of these things with our clients as much as we should, but we're just starting to talk about how do we deal with these emotions ourselves. And is somebody who's applying for veterinary school understanding that this is what is involved. This isn't just you get to save animals. There's a person
Right.
attached, and a lot of that takes a lot away from you. And are you ready to do that? I think a lot of people a lot of schools are starting to focus more on that, mental health and well-being of yourself, which I think will directly correlate to being able to give a little bit more and be more present and more compassionate for our clients.
Yeah, I'm glad that's happening because, as we know, I mean, the suicide rates are high. They're high for all medicine.
Yeah.
I mean, the last time I looked, it was doctors, dentists, and veterinarians.
Wow.
So,
Yeah.
and
They're,
that's
they're high. They're high across our society, higher than ever before.
yeah.
Wow.
Yeah,
Mm.
for everyone,
And that's
for human beings, 45,000, I guess, a year or something. I can't remember
Wow.
the exact, but it's very high compared to what it used to be.
Is
So-
that the United States or global?
Here, United
Here.
States.
United States.
Yeah.
that's why it's important to take care of ourselves, right? That's why I'm
Yeah.
glad that the schools are now starting to look at,
Mhm.
you have to be, good yourself,
Mhm.
and you have to know how to manage how you are and what your work is.
Mhm.
Because if you start to see, and unfortunately, sometimes in corporations, that's a little tough because they're told,
Mhm.
hey, you got to have so many clients that you see.
That's
And
the other part of it, right?
necessarily
That's
good.
the part. It's this pressure for production
Yeah.
is just so inhumane. Often it seems.
Yeah. And I mean, I work at a small private practice, so I don't feel that pressure, right, that a lot of corporate practices place on their doctors. But I do think it really does kind of conflict with that compassion too, because
Mhm.
I will tell you almost every day people call and the answer is, I'm sorry, I've already filled up my appointments and I've double booked my appointments and I just don't have time to see your animal. And unfortunately, the response is often, well, you just don't care then, or you're going to just let them suffer, or, what else am I supposed to do then? And yeah, sometimes the answer is I don't know, but I cannot give. And my perspective, when I first came out, I would have taken them all, taken them all. But I don't have time in my day, like hours is one thing, but let alone, I don't think we can practice good medicine and give the appropriate care that we need to if we're just saying yes,
Yeah.
yes, yes, we'll see you, we'll see you, we'll see you. It is not fair to the
No.
staff. It's not, but it's also, first and foremost, it's not fair to the animal that probably needs more attention than we can give.
Well, you have to replenish the cupboard before you can give it away, right?
Mhm.
So you have to have space and time
Yeah.
to
Yeah.
regenerate, rejuvenate. And
Yes.
so, and that's where the mental health and emotional health come in.
Mhm. I know ERs are tough and scary for people. It maybe used to be that your local vet was your everything, right? I hear a lot, especially in this small community. Well, old doc used to just give me a cell phone number and could come out at 3 a.m. and do these things. And that's great. But now there's an ER that exists, right? There's an emergency room. And just like human medicine, right? If you call your doctor and say, I don't know, I'm bleeding out, they're going to say, go to an emergency room, right? Or we can see you in a month. And that division, I think, is still fairly new in people's minds between what certain types of practices can provide for care and when. And so some understanding from clients on that aspect is a learning curve, I think. But is much appreciated when it does happen.
Yeah, it'd be good to have. When I did an internship at Blue Pearl, and it would be, and what the human pet parents came in was, I want to be seen immediately. It's an ER, it's a triage, right? To give them that information. It's all about the money. Or my vet said that you were going to do this, this, and this, but the veterinarian on staff in the ER said, no, we can do this. But I mean, there are these things that I would hope at some point in time, and I do think that some practices do this, but it's so busy, right, in ERs, this is how we work, right? But when people come in and they're so distraught and they're so emotionally involved, it's hard for them to hear that.
Yeah, it is. It is. And I think, the other part of it too, that would be interesting to think about is this, the training that maybe veterinary nurses get, because they really are the front line.
Right.
Yeah.
They're,
Right.
I'm
Yeah.
usually coming into a room after something's been triaged, after something, somebody's been really talked to about a lot of their things and why they're coming today. And I don't think they get a ton of training either. I think a lot of it's on the job, and a lot of it is a reflection of the doctors and the practice culture, right? To learn, this is how we talk with clients, this is how we listen to clients, and this is how we prioritize what's going on. But like you said in the beginning, it can be completely practice dependent, and I have seen it go a multitude of ways depending on even who the doctor's on that day, who's on staff, and how the nurses kind of receive their clients, probably because they don't have a ton of training in it for themselves.
Dr. Cole, you use a word I don't think I've ever heard before, veterinary nurse.
Yeah.
I've heard veterinary technician, but never
Technician,
veterinary
yeah.
nurse.
Yeah. And
Yeah.
yeah, and usually I usually do call them technicians. I call them my techs.
Okay.
I think most people, there's a little bit of a shift in language that's trying to happen towards calling them nurses, so that there is
Makes
more
sense.
of an understanding about what they do. Because I think some people still don't understand that they're trained to do everything that a human nurse would be
Yeah.
doing, right? Like how to triage, take vitals, take blood, run tests, make certain recommendations up to a point, all of those things. Yeah.
So it's kind of like a nurse practitioner for human beings.
I think their schooling is probably a little less, from my understanding, than a nurse practitioner, but certainly a nurse.
Yeah.
And there is a variety depending on the state. Certain states require all technicians, nurses to be licensed, others don't. And in Massachusetts, anyone can technically be called and hired as a technician and have no training, get
Oh, really?
on the
I didn't
job
know
training, or they can be licensed.
Wow.
that. Wow, I didn't know that. Right.
The other thing I admire so much about veterinarians is all of the animals that you have to know. It's not just a human being.
Yeah.
You know,
Yeah.
It's wildlife, livestock. I mean, cats and dogs.
Camelids. I'm very
Yeah.
interested in that.
Yeah. I think that's something that is very much part of this too, is like we're tasked with learning all of that in 4 years, right? I feel like we barely scratch the surface of some things, some species, then let alone getting to some of this human animal element. It's a lot. It's a lot. And you will find significant cultural differences between people, say, who raise horses or cattle and
Oh,
small
yeah.
animals, right? So the
Right.
companion side versus, like, horses, I would entirely call companion animals, but they're also treated as working animals or even as part of a livestock crew. And so those types of conversations can go very differently. Expectations from clients, their bonds might be very different. And the way that they expect certain things that we can do are sometimes very different. And so as a mixed animal practitioner, it's like switching on the gears and the hats based on the species is interesting.
Yeah, I grew up on a farm, so, and we killed animals, right? So that's a farm mentality. So there was a distance, my dogs I loved, and of course my dogs weren't killed, but what we raised was killed. And so, but that was what it was. There wasn't a bond to it. That was the business side.
Yeah.
So,
And I remember when I first came to see you for my chicken, that you were very compassionate and were treating it exactly as I think you would have treated it if it were my cat or dog.
Yeah.
And it was very interesting to me because my relationship with them is different. It's different. And so it was something to see that. And
Yeah.
I appreciated it.
I see the gamut of chicken people. So people who show up and just say, well, if it's sick, we'll just put it to sleep. Like, that's kind of what I was expecting. And other people who are like, they treat them just like members of the family. I want to try everything. The way I think about it before I step into the room is, if this person is willing to pay me for an office visit, for my physical and my advice, the same as I would charge for a dog or a cat in an appointment
Yeah.
slot, then I'm going to treat it the same. I'm going to go in and I'm
Yes.
going to give it my same effort and my same compassion, because
and
that's what they wanted to do. And so I'm here for it.
yeah,
Excellent.
yeah.
Ken did talk a lot about that, Dr. Cole. He was
Yeah,
very,
I appreciate
very
it.
moved.
very
Very moved by that.
I appreciate that. Yeah.
And yeah, I also was of the opinion that if this was something that was pretty serious, it probably was going to be the end of their life. But I wanted the ending of their life to be as soft and compassionate as it could be.
Mhm.
Yeah, absolutely.
So I think we're at the end of our time. Anything else that you would like for people to hear about this whole idea of the human element of veterinary practice before we close?
I think we've covered it pretty well. I think, we talked about this a little bit last time in our last discussion, but I think open communication is just really important.
Yeah.
Sometimes, like I said, sometimes we can read a room really easily, and sometimes it's not so easy, right? So the best advice I would have for pet owners is to, stop your vet if you need to and say, like, that, this isn't working for me, or I think I just need more information. How can we get more information? Or I think less information is better. Can you just be honest? I appreciate it so much when people just say, don't sugarcoat it for me. Tell me exactly how you feel this is
Yeah.
going to go, or what I should do, versus, which sometimes I hate that question, because I'm like, I can't make decisions for you, but I will tell you, if you want an opinion, I will give you an opinion, versus, if you think, you're like, I just want to hear all my options and I want to take it in and I want to process it, then I want to know that too. So the open communication is extremely important, because I think it helps us figure out how much and how often and how in which way to direct our compassion, and how to kind of communicate better about the things that we're all trying to achieve, which is how to make sure your animal is as healthy as possible, or has as little pain or suffering as possible.
Yeah. Well, thank you. That's
Very
a
nice.
great point to end on. And thank you so much for being with us and all that you do, and the kind of compassion that
Yes.
you always bring to your work.
Thank
And
you.
I want to just remind people that if you do find this program to be useful, please consider subscribing on YouTube. If you're not watching or listening on YouTube, there's a link in the description that'll get you there quickly. Thanks very much.
Thank you,
Thank
Dr.
you.
very much.
You're very welcome. Thank you for having me.